What is the difference between reflux and eosinophilic esophagitis? Imagine feeling like there's a fire in your chest or food getting stuck when you swallow. These are common signs that something is not quite right with your esophagus. Today, we're going to explore two conditions that can cause similar symptoms but are very different in their causes and treatments. Reflux, also called gastroesophageal reflux disease or GERD, happens when stomach acid flows back into the esophagus. This occurs because the lower esophageal sphincter, a muscle that normally keeps acid in the stomach, isn't working properly. The acid irritates the lining of the esophagus, leading to heartburn and sometimes regurgitation of food or acid. If this happens often, it can cause inflammation called esophagitis. Eosinophilic esophagitis is quite different. It is a long-term immune system problem where a type of white blood cell called eosinophils builds up in the esophagus. This buildup causes inflammation that can damage the esophagus over time. Eosinophilic esophagitis is often triggered by allergies to foods or environmental factors, and sometimes acid reflux can make it worse. The main cause of reflux is the malfunction of the lower esophageal sphincter, which allows acid to escape from the stomach. In eosinophilic esophagitis, the immune system reacts to allergens, leading to inflammation even without acid reflux. Symptoms can overlap but also differ. Heartburn and acid regurgitation are typical for reflux. Eosinophilic esophagitis often causes difficulty swallowing, food feeling stuck, and chest pain. Sometimes, both conditions can cause chest discomfort, making it tricky to tell them apart. When doctors examine the esophagus, they look for signs of damage. Reflux can cause redness, erosions, or even Barrett's esophagus, which is a change in the lining. Eosinophilic esophagitis causes rings, furrows, and narrowing of the esophagus, which can be seen during an endoscopy. To confirm eosinophilic esophagitis, a biopsy is needed showing more than 15 eosinophils in each high-power field of tissue. Diagnosing GERD often involves symptoms, response to acid medications, pH testing, and endoscopy showing erosions. For eosinophilic esophagitis, a biopsy is essential, and it may not improve with acid-lowering medicines. Treatment for reflux usually involves medications called proton pump inhibitors that reduce stomach acid. Lifestyle changes like avoiding spicy foods, losing weight, and not eating before bed can also help. For eosinophilic esophagitis, doctors recommend dietary changes to avoid allergens, topical steroids, and sometimes proton pump inhibitors, though these may not work for everyone. Understanding the differences between reflux and eosinophilic esophagitis is important because their treatments are different. While both can cause discomfort, accurate diagnosis ensures you get the right therapy. If you experience persistent symptoms, seeing a healthcare provider for proper testing is the best step.